Ah, anɔpa deɛ no MPs no ɛdɔɔso maame no deɛ minus 50 and 5. And then away. I don't know if you scan also.
Hello, good evening, ladies and gentlemen.
Good evening, Grandpa.
Welcome back to another week.
Thank you.
So gradually, we are getting close to the end of the program. We started the actual semen analysis, and we went through patient preparation, and we've also gone through the aspects of the first phase of semen analysis, which is the macroscopy. Macroscopy is done with the element of liquefaction and then the gelation. We've also done the viscosity. All right, so there are a few other things on the macroscopic examinations which you're going to do today. All right. Is there, as usual, is there any question or something anybody wants us to discuss or take a look at? Just in case there's something somebody wants us to have a look at.
Yes, sir. There is a small concern.
Okay, Kingsley.
Okay. I just met a relative 2 days ago, and he was discussing with me about his preparation towards semen analysis.
Okay.
And according to him, the personnel told him he has to avoid taking milk and egg.
Milk and egg?
Yes, please. Prior to the collection of the sample. So he was asking me.
So you see how people are doing things. Okay, so whatever you are asking the patient not to do, you have to find its effect on semen.
And I said between avoiding milk and semen analysis.
Okay,
so I wanted to know if maybe there is any relationship.
No, as far as I know, but as far as I know, no. Whatever you say the patient should not do or should avoid or should modify should be something that is well known to have an impact or influence or effect on the semen quality. Okay, all right. Egg and milk, I don't know. As far as I know, I don't know. All right. So just tell the person or ask the person who asked the patient not to take in egg and what is the import? What is the basis? So if it's a colleague, ask the person, because these are the things that are happening across the country in some laboratories, and its impact is affecting all of us. Those, I don't know, if you, especially if you now have adequate knowledge in the things that we do, and you see somebody also doing different things, you see how painful it is. Or because I don't you feel?
Yeah, I hope, because I don't know that.
So our people are doing all this stuff. By the time you finish the whole program, you see that a lot of things people are doing. I don't know. All of us across everybody must be trained somehow. Everybody must be trained. All right. Okay. So thank you, Kinsley. So for as long as the person can prove that it is well documented in literature that egg and this have an effect on semen quality, then that's okay. But I haven't come across anywhere where egg and milk is noted to have had any effect on semen quality in terms of the parameters that you are discussing, even including the volume. Of course, as we come by how far you've come, you know that even some medication, if you don't say all medications, say some medications, okay, and you have notable ones, and those that are noted for impacting on this, and they will tell you why. A lot of them, like you know, are anti-androgenic. Okay, and when it's androgenic, that is have got to do with the production of testosterone. Okay, so yeah, for example, cimetidine. We always talk about cimetidine. Cimetidine is a very good drug. Almost every patient who is being treated for GERD, GERD, GERD. Who knows the condition called GERD, GERD? Can somebody tell me if you have any, if you know something about GERD disease? GERD, GERD. Of course, it is an abbreviation or an acronym. GERD.
Yeah, gastrointestinal.
Gastroesophageal reflux disease. Okay, so where you have an ulcer, or where or you have the gastric acid. I mean the gastric acid due to which is creating an ulcer of a sort, which is also pushing up along the esophagus. You see, so you have people who complain of, let's say, the that's like some not a pain. It's not a pain. It's like a burning effect around the heart area, and you know it is the one of the conditions of people with peptic ulcer or I mean stomach ulcer, as the case may be. So you have the acid trying to move up, and once they move up, I mean it means that they're coming to the esophagus, and so you know acids will also create a burning effect, and so people have that kind of thing. So that's gastroesophageal reflux disease. One of the commonest medications is cimetidine or Tagamet. All right. So you know that people use it all right, and it is very good. However, this same drug have an effect on the HPG, which is the hypothalamus pituitary gonadotropin. You know the HPG, the hypothalamus pituitary gonadal axis. It has effect on that. The same drug which is giving you a good listen is having effect on the HPG. And once you have effect on HPG, it's necessarily going to have effect on your testosterone production. You understand? So this drug, which is very commonly used, if the patient is on it, even that one, I've told you, once it is a prescription drug, you have to discuss with the doctor. You have to, or if you have a way of, you have to discuss with them, because if you ask the patient to stop the medication and the conditions also get worse, I mean, they will tell you, why did you have to ask the patient to stop the medication? So you have to ask the doctor. You have to tell the doctor, now the patient have this prescription drug from you or from another doctor, but this drug has effect on the test that you have requested to do. And so two things, if you have to stop the medication or if you have to complete. So you discuss with the doctor, and the doctor, it's left with some few days for the medication to finish. So let's finish. After that, then you can start the preparation. So that becomes all right. Or certain hypertensive drugs, well known. As we move along, you are going to see spironolactone. Spironolactone is also a very commonly used antihypertensive. However, it is also a diuretic. When you say diuretic, what does it mean? It causes you to urinate a lot. Once it causes you to urinate a lot, you are indirectly you are reducing the body hydration levels, so you become more or less dehydrated. Once you have more dehydration, it has effect on the secretions from the seminal vesicles and all of that. And once you have low secretions of these things, they will also give you, as we move into volume detection, they will cause a low volume of semen. And so all the drugs that have been noted to have effect on semen analysis, they have all been documented. And the reason why they are giving you that indications to is well documented, is well known. All right. So please, ladies and gentlemen, even as you go through the program, you shouldn't end there. Now you have gotten a lot of insight into semen analysis. You can learn more, because I don't know it all. Okay, I don't know it all. So you can also tell yourself that you also want to be very knowledgeable, you want to be very good, you want to be an expert in semen analysis. And then you can also learn more. And if there's any program outside, now once I got interested in semen analysis, let me go back a little bit. When we were working in Confanache, those years, when we were in school, at whichever level, whether it's certificate or diploma or degree, whatever, they never teach semen analysis, as far as I know. At least where I was trained, they never teach semen analysis. And in Confanache, the man who was doing semen analysis was even a hematologist. He was a senior man for doing semen analysis. And it is like so exclusive, private, that he wouldn't allow anybody to even become close. This man went on retirement and gave it to another person who was also in microbiology. And then this man was also doing that one too. It's like a sacred, there's something. Okay, he does it, and when he's not there, nobody does it. And then I said, what kind of thing is this? So I also tried to just try to get close to this man and then be learning small. Then I said, no, I have to get more education in this area. Okay, so I tried to also now read more about that. Unfortunately for me, I had opportunity to go to US, Utah. And then even though I was in microbiology, but I decided to rather go to their andrology lab. And I spent 3 weeks there, learned a lot, learned all the things that I know about semen analysis, about 90% of them. I learned from the andrology unit from Utah. So that is how it is. So what I'm saying is that, unfortunately, from school up to date, it is not part of the syllabus or course content of as we move along. And you are being trained. So please also get the interest. The thing is that you should get the interest. Some of you, like I said earlier, some of you want a certificate, just that you have the certificate without actually, sometimes if you don't even want to take part in the training, but you want certificate. That is not something that I think I will support. So I want all of you to now also be trainer of trainers, like we are being trained also to train others, so that at the end of the day, you have a whole lot of laboratory people having more knowledge in this area. So I'm saying that, yes, I'm giving you the little that I know. You also have to learn more about it. And when there are even higher opportunities elsewhere too, you can also specialize in these areas and become experts. All right. So Kingsley, Moses, and Co. That is the little that is I can add for now. All right. Good. So let's move on with today's work. You have now we are on semen color of semen. So semen color varies, but normal semen is typically grayish white or whitish gray. When you say it's gray white, it means like it is like off-white. When it's off-white, you can describe it as grayish white or whitish gray, whichever is a mix of a white and a gray color. So that's why you have it as grayish white or whitish gray, whichever way. And it's creamy. When it's creamy, it's like milk. Okay, I don't know whether it is because of the milk nature why somebody says that you should avoid milk. No, but it has the texture of a milk, especially milk which is going bad. No, once milk is going bad, gives that kind of creamy kind of appearance. All right. So, and it can also be described as opalescent. Hence, opalescent, it means that you cannot just be able to, it's not transparent. That is what it is. It is not transparent, but it's not also turbid or opaque. When it's opaque, it means you can't see through at all. But when it is opalescent, it means that you can see through with difficulty. Okay, so it means that it's slightly cloudy. And sometimes it can have a yellowish tint. All right, so this is the normal appearance or color of semen. Any of these you see is still normal. All right. But when it's very cloudy, it's also not a bad thing. When it's cloudy, it sometimes indicates the presence of high sperm cells. If there are too many sperm cells in it, the cloudiness of a liquid is attributable to cellularity. That's the number of cells or particles in it. Okay. Now, so if you have too many cells in the seminal fluid, of course, it will become very cloudy or turbid. So turbidity or cloudiness per se is not a bad thing. It can still be normal, only that it could indicate that there are more sperm cells. And indeed, once you do your sperm count, you see that the sperm count is actually very high. However, if it is also, you said anything high cellularity. Cellularity could be blood cells. It could also be the sperm cells. So if you have a situation where there are also past cells, for whatever reason there are past cells, then the past cells will still make it cloudy anyway. So two things: the cloudiness can be normal. It can also be abnormal. If you see it as cloudy, you don't, in the first place, you don't see that it is abnormal, unless you do a microscopy and see that, oh, after all, there are past cells which are in it. Then that makes the cloudy nature now become abnormal. Otherwise, cloudiness on the first on the face value, you can't say that it is abnormal. I hope that you are following me. All right, good. So semen mixed with trapped urine in the urethra can appear yellow, because you think that slightly yellowish color is also normal. And where it is coming from is likely because if somebody also produces urine, okay, and then after which he produces the semen, if you don't take care, you have a situation where some, because this tract is urogenital, the same tract is allowing urine, and the same tract which is allowing the semen. All right, so there could be traces of urine which are trapped. Now, if this urine now becomes part of the semen, then you could say that instead of the semen being grayish, it could turn a little bit yellowish. All right. But if it is too yellow, then that's a different thing. We will talk about it. Now we are talking about normal semen appearance and color. Normal semen. And so you have to get all this. So we are doing the semen analysis, not just also by, you see color, you are going to look at color. Color is either this or that. No. So even with the color, we try to give you a lot of education and a lot of knowledge on all the things about the color. Okay. As you move to volume, you also do so by the time you finish, it's not just a matter of color of semen, even how the color comes about, what other colors can come, and all those sort of things. You will be very knowledgeable in all of that. All right. So still on normal semen color, aging. If somebody is aged or becoming more older, then the semen is naturally going to be more yellow. And so once you have a more yellow color, it doesn't mean that there's a problem. Okay, so it is also accumulated granule due to accumulated granules and dead cells, because apparently once the person is old, may not be very, very much sexually active. Okay, and so you can have a lot of dead cells also appearing in the semen, and those are likely to change the urine color to more yellow. Okay, all right. Semen color can also be influenced by ejaculatory abstinence, and the period of ejaculatory abstinence is the period it takes for a person to ejaculate. I try to use this word more than the sexual abstinence, because as far as semen is concerned, semen analysis is concerned, anything that will cause you to ejaculate, okay, is what is important. Is the ejaculation which is more important, not the sexual, not the sexual. So if you say sexual abstinence, then if for about 1 month the person has not had sex, You say that I've had 1 month of sexual abstinence. Meanwhile, in between the 1 month, he may have ejaculated either through wet dreams, or even through masturbation, or through whatever. He might have had all those sort of things. But because you said the sexual abstinence, he will tell you that for about 1 week or 2 weeks, I haven't had sex. Okay, so, but when you say ejaculatory abstinence, then you say that, okay, so ejaculation too could be due to sex. But it could also be due to non-sexual activity. All right, so if for a very long time the person has not ejaculated, and now he's producing semen, the semen color will be completely different from somebody who ejaculated 2 or 3 days ago and is producing semen for you today. All right, so semen appearance or semen color can be influenced by the period of ejaculatory abstinence, which most people say sexual abstinence. I want us to be used to ejaculatory abstinence, period of ejaculatory abstinence, more than the sexual abstinence. Okay, all right. So semen may appear transparent. Transparent, it's like when you see it, it's like water. Okay, but of course they will necessarily be, because after all, it will be more viscous than water, and so they will not be transparent as in water, though, but it's something like you say that it looks clear like water. Okay, now for short sexual abstinence, if for within 2 days or 3 days you are producing the semen, then the semen could be transparent, especially if the person don't have a high sperm count. If the person has a low sperm count and the abstinence period is also short, you see the semen, you yourself look at it and say the semen with a very low count. Okay, so once it is transparent, you may suspect that the abstinence period was very short. Similarly, it may appear more yellowish due to an increased length of sexual abstinence. So for a long time, if the person have not had sex or have not ejaculated for a long time, of course, you know that then the semen sperms will also increase. And we are saying that the appearance for that color is usually influenced by the cellularity. And we have learned already that as the period of abstinence prolongs, sperm count will go high. So once the sperm count goes high, it means that there's high cellularity, and therefore this thing will become more cloudy. Okay, and once it becomes more cloudy, it's more yellowish, and so forth and so on. Okay, so let's now see what to make a semen color abnormal. So we say that slightly yellow color may be normal for the reason that we have already cited. But if it's dirty yellow, then it suggests high parcels, pyospermia. So the presence of high number of parcels will usually make it dirty yellow. Okay. And when you say something is secretive infection, you know that once you have infection, sometimes depending on the cause of the infection, some bacteria will cause the production of more parcels. For example, if you have Pseudomonas infections or Staph aureus infections or Neisseria gonorrhea infections, these are infections that normally will trigger a lot of parcels. So we say they are suppurative. Suppurative. When we say suppurative infection, it means that it's an infection that actually produces a lot of parcels. Okay, and once that happens, you see from the semen, and especially if the infection is along the reproductive tract. Okay, they will necessarily find them in the semen, and the semen color will turn dirty yellow. All right. Okay, then factors like dehydration or diet high in certain foods, vitamins, and drugs can temporarily change semen color. You say they temporarily change semen color because if it is due to dehydration, And you know that the sperm which is coming will have to swim in a certain volume of water. And this water, I'm talking about the semen, seminal fluid. Now, if the seminal volume, the volume of the liquid or the seminal plasma reduces, it will give an indication that the appearance will become like cloudy or more cloudy. I don't know whether you are getting confused. That we are talking about dehydration here. Factors like dehydration can cause your semen color to also change. This is what I'm trying to explain.
We see what in that.
Ishak. So if there's dehydration, it gives it makes the seminal fluid more concentrated, apparently, because it's like the fluid volume is reduced, but the cells, and for that matter, the sperm content is also the same. Once the fluid content is reduced, it gives, in quote, an indication of high concentration. And you know that once the fluid becomes more concentrated, it gives the appearance of cloudiness, which is also gives it more yellowish tinge. So those are the things that can, even before you even go into the examination. That's why these things are macroscopic. So you are seeing the thing physically by naked eye. You can give a certain indication that, oh, this semen, it looks cloudy. Then when I look at it, you can even ask for the patient. That's why we said that sometimes you may even have to ask certain factors, whether within the 2 or 3 days that was abstaining or we are preparing, whether he had any illness. If he tells you, oh, in the past 2 days, I've had diarrhea power, then you know that he had dehydration, and therefore that can cause semen volume to reduce. And once the semen volume reduces, it will give a false appearance of the color. Okay, so those are things that you should know, so that whatever you are seeing and whatever you are writing, you have a very fair, good scientific knowledge about it. So we have the, if it's also dark yellow, if the patient, there are certain vitamins or certain drugs that even if you take, your urine color will change. So once the urine color changes, and we know that the urinary tract is the same place where you're also having your semen coming, then the color of the urine, which is occasioned by the vitamins or the drugs that you're taking, could also make the urine, make the semen more dark yellow. And of course, if the patient is already jaundice, of course, that yellow jaundice color can also reflect in the semen. And so forth and so on. Of course, we also have blood-stained semen. If the semen is blood-stained, sometimes it could be pink, it could be red, it could be brown, it could be orange. All of them indicate that there's blood in the urine. You try to differentiate between whether the blood is fresh or an old blood. Okay, so if you see the semen color being pink or red or brown or orange, your first suspicion is that there's blood in it. Okay, and that is called hematospermia or hemospermia, whichever way you take it, is still acceptable. Hematospermia or hemospermia, that's blood in the semen. Okay, it may be due to an injury, of course. It could also be due to an STI or infections of the male reproductive organs, or even high blood pressure. Because all of us know that once you have high blood pressure, sometimes you can have certain vessels which can get damaged as a result of the blood pressure. And of course, you know the issue about CVA, cardiovascular accidents, where the blood can even rupture in the brain and cause CVAs and so forth and so on. So similarly, if somebody has blood pressure, especially the one that is not managed very well, once it produces semen, it can have some small veins also rupturing that will also cause blood to leak into the semen and give you that blood stain appearance. Okay. Now, if the semen is, the color is pink or red, that one indicates that there's fresh blood. I mean, the bleeding is very fresh, along the genital tract area or very close. Okay, right. When it's brownish or orange, it means it's an old blood, and you know that once blood gets older, okay, it gets brownish. This one, you know it. That if, let's say, you take blood sample and then it is first on the floor. If you don't clean it up, allow some few hours, you see that the blood is turning brownish. So old blood, if there's some old bleeding which has occurred along the tract, okay, then as the semen being produced, it will reflect as brownish the semen. So that way it tells you that the patient had some bleeding a couple of weeks back. Okay. And as to the cause of that bleeding, it could also be a different matter that could also be investigated. Okay. So abnormal semen colors, foods that are high in sulfur, like garlic. Garlic is known to have a high sulfur content. Okay, it's been noted that if you take foods that are high in sulfur, example garlic, they will result in semen color becoming very yellow. Okay, semen color can also be green if there's an infection. Okay, what infectious agent will give you green coloration? What organism will give you a green coloration, even if you have urine?
Pseudomonas.
Pseudomonas, sure. So if you have an infection caused by Pseudomonas along the genital tract, of course, you see the semen to be greenish. So don't be afraid. If you get somebody with green, you shouldn't be, hey, I said, anyway, you know that there's an infection. And that infection is very likely to be caused by Pseudomonas. Okay. And so in that case, you can request that they do your semen culture, or you can even have a fair idea about where is it likely to have if the infection is along the urinary tract, then just urine culture will do. Okay, all right. As we said, dark brown or black colored semen could be old blood. Okay, the dark brown could be old blood, but that old blood, especially when there have been spinal cord injuries. Now, once the spinal cord injuries, it takes a long time before it gets into the semen and to become dark brown or even black. Also, exposure to heavy metals like lead, nickel, platinum. These are heavy metals. Once you are exposed to this, and these are things that can occur, especially with people with these days that we have this rampant exposure to heavy metals from galamsey sites and so forth and so on. You shouldn't be surprised if you see somebody producing black colored semen. All right, then you know that it is due to exposure to heavy metals. Right. So once you know all these things, I'm sure that no semen will come to you and to surprise you. Whatever color comes to you, you know that, oh, it's likely to be due to this, it's likely to be due to that. Okay, right. And then watery semen. Semen which appear watery or thin or transparent, for that matter, clear, can sometimes indicate low sperm count or even a lack of sperm in the ejaculate. Once there is no sperm, you know that whenever there is a liquid, it can only become cloudy due to cellularity. So if you have semen and there are no sperms in it, it's likely to be watery. Okay, right. Then frequent ejaculation. If you have somebody who masturbates or engages in sexual activity multiple times each day, that person, once he produces semen, that semen will be like water. Okay, because there's no time even for sperms even to accumulate. So the person is just giving it out. So frequent ejaculation can give watery semen. That is also a fact. Then, also interestingly, you know of retrograde ejaculation. I think during the andrology period, we did extensively on retrograde ejaculation. All right. So once there's retrograde ejaculation, it means that much of the semen will go, instead of flowing antegrade, coming forward, they rather retrograde, go backwards. So sometimes they just few, and that few that's coming is just and you know that the first portion of semen is where you have the sperms and the prostatic fluid. All right. So if they have to go, it is that portion which will normally go into the bladder. And the rest that will come in is actually seminal vesicle fluid with very little amount of semen in it, with sperms in it. You know this already if you know your retrograde ejaculation concept mechanism very well. So, and this semen is likely to be very watery. Okay. So if and all those things will also trigger your suspicion. Oh, I'm seeing this and this, so I'm suspecting this. So the first thing that you must have a high index of suspicion based on what you know. Okay, right. So that is about the color. I'm sure we have color is macroscopic, what you see, and so there's nothing to measure about it. All right. So then you come to semen volume. Okay, volume is also one of the physical examinations or macroscopic examinations. All right, so semen volume to always will give you an indication of the secretory functions of the accessory glands. You know that the amount of fluid is coming out is a total contribution from the testes through the epididymis and then the vas, seminal vesicles, prostate. So all of them are this coming together to give you the seminal fluid. And of course, you know that the largest volume is coming from seminal vesicles, followed by the prostate. So if the volume is high or normal, it tells you that all the all the accessory organs or glands are working. Okay. If it is small, then it tells you that there's something wrong with some of the accessory glands. So volume gives an information about the functionality of the accessory sex glands. All right. A precise measurement of the ejaculate volume is also important for assessment of the total sperm count per ejaculate. You see, as you move along, we are going to look at sperm count itself is a concentration. And you know that concentrations are something per mil. Okay, so if you talk about sperm concentration, it is what people normally call the sperm count. The sperm count is the sperm as you have counted per mil of the ejaculate, per mil of the ejaculate. Now there's what you're going to see later on as the total sperm count. The total sperm count will be your count per mil multiplied by the volume. Okay, so if you are going to get your total sperm count and your volume measurement is wrong, it is going to give you a wrong total sperm count. I hope that you are following me. I'm saying that there is sperm count, which people, I mean, that's what a lot of people know. And sperm count is a concentration parameter. Concentration is something per mil. Okay. something per mil. So when you do your sperm count, it's going to whatever you get per mil. Now, then there's also another parameter you're going to do, which will be the total sperm count. Total sperm count will be your count per mil multiplied by the volume of the ejaculate. So if the volume of ejaculate is not measured well, then it means that your total count is going to be also wrong. Okay, so that's how come semen volume measurement, we don't joke with it. You have to be very exact, not an estimation. You have to be exact, so that once you have the exact volume and you are able to do your count per mil, you can now multiply your volume, which you have measured, and multiply by the count per mil, and then you get your total sperm count. All right. So the semen volume is also measured and recorded in milliliters. Okay, in mils. Right. Let's see whether you can also get some, what are the means of measuring semen volume? There are three ways people do it. Now, the cheapest way and the most crude way people use is just using disposable graduated pipette. They have a pipette, so, some of the pipettes are graduated. So they use the pipette and try to pick it up and then see the graduations. So you see that virtually you're estimating, because you are not going to get exact volume. All right. Secondly, even as you are using the pipette to collect it from the container, there could be some remnants of the container, of the semen, which will be left in the container, which you cannot measure. Okay. And then again, if let's say most of the pipettes that I know that are calibrated, they are up to, let's say, 5 mils or so. All right. So if you have somebody producing 7 mils of semen, what are you going to do? You see that you measure the 7 mils, put it somewhere in another container, and then come back and take the rest, and so that gives a lot of inaccuracies. Remember, we said that we need accurate volume measurement to be able to also exactly calculate your total sperm count. So if you are going to use a means which doesn't give a precise measurement, then did you go or did you come? Okay, right. So that's one approach which we don't recommend. Okay, but people use it anyway. Then you use a 10 mils measuring cylinder with graduations to the nearest 0.1. What it means is all of us have measuring cylinders in our labs. Okay, I'm sure most of you don't have 10 mil cylinders. Do you have any one of you who has a 10 mil measuring cylinder in your lab? Anybody? Or a 5 mil measuring cylinder? Do any of you have one in your lab? Either 5 mil or a 10 mil measuring cylinder? Hello?
Hello, Grandpa.
Is anybody using either a 5 mil or a 10 mil measuring cylinder in your lab?
No, please.
No, please.
I think that either you have 100 mil measuring cylinder or 500 mil or even 1 liter. That's one you have. Okay.
Yes, please.
So, but you see that you are dealing with a sample whose volume will never be more than 10 mils. Okay, for whatever means, it can never be even more up to 10 mils. So if you are going to use a measuring cylinder and you are going to, you only have a 50 mil measuring cylinder. You see that if you have a 50 mil measuring cylinder, you can't even get 0.5 to measure. You can't even get 5 mil to measure. It starts with 10 mils, and then you have 20 mils, 30 mils, and with some few gradations in there. So, but if you want to use a measuring cylinder, if you have a 10 mil measuring cylinder, with a 10 mil measuring cylinder, you have the divisions. So you have 1, 2, 3, 4, up to 10. And in between the 1, 2, 3, 4, you have the small marks between the 1 and the 2, which will be also 10. So you see that from the 1, you can get 1.1, 1.2, 1.3, up to before you get to 2. from 2, you can get 2.1 up to that kind of thing. So if you're using a measuring cylinder, you can't use any measuring cylinder other than either a 5 mm measuring cylinder or a 10 mm measuring cylinder. That one you can get and even that one, it means that you must have to pour the sample from the sample container into the measuring cylinder. And when you finish, you're going to pour back. And you see that in all of these things, you're going to have some sample loss. You're going to have some sample loss. Yes, dear.
Please, can you use syringe to measure the volume? Like
that's what people do. That's what people do, but that's also very, very wrong. That's very wrong. You see, you need the 0.1. What it means is that the measurement of semen is recorded in up to 1 decimal point. Up to 1 decimal point means that you can have 0.5. Let's say you can have 0.6, 0.7, 0.8, up to, let's say 1.1, 1.2. All that. I don't know whether the syringe can give you that kind of 0.1, 0.2, 0.3 components. So in all of it, it means that you are going to do an estimate. You are going to estimate. And we say that before this side, we are saying that we need a precise measurement as much as possible. Okay, so if you are going to use the syringe, all of them, you may have to estimate along the line. And that's also very not well, it's not a good approach. It's not a good approach. Now let's take this approach.
Hello, Grandpa.
Yes, sir.
Please, with the measure of the volume, let's say the sample or the semen is highly viscous. So will you wait and measure it after liquefaction or right away?
You see that, very good. So you see that in all of them, either the disposal pipette or syringe and then the measuring cylinder, all of them, the sample will have to liquefy before. Okay, if they have not liquefied, even if it's a syringe, how can you take it? The sample has not liquefied. But if it takes a long time to liquefy, what is it? So you will see that these two, all the approaches that we are using now becomes problematic. I'm going to take you through this third one, and all of you, I'm sure you will switch to this method. You will switch to this method. Very, very simple, very, very simple, and also very accurate. All right, so it is by measuring the weight of the ejaculate. This is an indirect approach of the assessment for semen volume. It's an indirect approach because you say that you want a volume. Now you are going to weigh. Weighing and then measuring volume are two different things. Okay, in actual fact, the weight of something, weighing something, and then the volume of something are two different. So if you are going to use the weight to get the volume, then it becomes an indirect approach. I hope that you are getting me. However, by the time I am done with you, you see that it is the easiest and best and most accurate way to do your semen volume. All right. So now let's see the measurement of semen volume by weighing. Okay. Semen volume is best measured by weighing the sample in the container in which it has been collected. Give me a sorry, I had just small disruption. Okay, so we are going to measure our semen volume by weighing. Okay, and you see that this method can preferably be done at the time of the sample is received, and before incubation. That is whether the sample has liquefied or not. you can do this. How do you do it? So first, you take the pre-ejaculate weight. Pre-ejaculate weight is before the person ejaculated, the container. So what it means is that the container that you are going to give to the patient, you weigh it. Of course, you weigh with the and like we said, I recommend that you procure your own containers, which you give to patients. Not that the patient will go and buy a container and then so you have a hold on the containers. So the container should necessarily have a lid. Before you give it to the patient, you weigh it. Okay, and I'm sure everybody has a weighing machine, a balance in the lab. If you don't have a balance in your lab, please go and have one. And these days, almost all the balances are electronic. So they can even give you 0.001. Okay, right. So you take the weight of the container that you are giving to the patient, of course, with the lid. All right. So, and that's what we call the pre-ejaculate weight. The container without anything is the pre-ejaculate weight. That is the distance. So that's the empty container. So at the time that you are giving it,